Welcome to the culture of healthcare, socio-technical aspects, clinicians, and technology. So, in this series, we explore what it means to work in healthcare from the perspective of healthcare technology management. If you're a biomedical equipment technician or a clinical engineer, your role is about far more than maintaining machines. You're part of the culture of healthcare itself. Here, technology, clinicians, and patients intersect every day. We'll look at the expectations of working in healthcare environments, how care is organized across departments, the impact of privacy and security laws, and the professional and ethical challenges that come with balancing safety, cost, and collaboration. By the end, you'll see how the culture of healthcare shapes your work in HTM and why your role is so vital to ensuring safe, effective patient care. In this module, we're looking at the socio-technical side of healthcare, where people, processes, and technology collide. Here's what we'll cover. First, we'll define medical error and patient safety and explore how HTM professionals make technology safer. Then, we'll analyze errors not just as individual mistakes, but as system-level problems shaped by design, maintenance, and workflow. We'll compare and contrast social factors like team culture and clinician habits with technical ones like device design and system constraints to see how resistance to change takes root. Next, we'll talk about the challenges of adapting workflows when new technology arrives and how HCM can step in to smooth that transition. We'll also dig into the risk of forcing technology into old habits and why that can hurt safety and reliability. Finally, we'll look at the big picture, how socio-technical change impacts quality, efficiency, and safety, and how HTM supports safe adoption and continuous improvement. Let's dive in. In healthcare, technology and people are inseparable. Every device you maintain, calibrate, or troubleshoot isn't used in isolation. It's part of complex workflows shaped by culture, priorities, and pressures. This is the core of the socio-technical systems approach. Safe care depends not only on machines working properly, but also on how those machines interact with human behavior and organizational systems. This lecture zeroes in on two big ideas: medical errors and patient safety. Medical errors are mistakes that occur during medical care, and many of them are preventable. Grober and Bonin define them as the failure of a planned action to be completed as intended, or the use of the wrong plan to achieve an aim, an unintended act, whether omission or commission, that fails to achieve the intended outcome. Deviations from the care process which may or may not harm the patient. So, patient safety is about protecting patients from harm caused by those errors. From an engineering perspective, it means making sure the systems you support don't introduce risk, and when possible, they actively reduce it. It ties directly into medical ethics. Primum non nocere, first, do no harm. The World Health Organization defines patient safety as the prevention of errors and adverse effects to patients associated with healthcare. And as care grows more complex, with older, sicker patients, more advanced technologies, and tighter budgets, keeping patients safe becomes even more challenging. For HTM professionals, this is where work becomes vital. Every device you inspect, every alarm you manage, every network you secure, every calibration you perform, these aren't just technical tasks, they're part of the system's defense against harm. The key takeaway here would be reducing medical errors and improving patient safety are not just clinical goals, they're also engineering goals. In modern healthcare, safe care depends on clinicians and technology working together seamlessly, and that makes your role essential. Medical errors have been around as long as healthcare itself, and for HTM professionals, understanding their scope is critical because technology can be either a safeguard against these errors or the source of them. Let's take a look back. In 1964, researcher Schimmel reported that 20% of hospital patients suffered iatrogenic injury, that's harm caused by medical care itself, and 20% of those injuries were serious or fatal. Fast forward to 1999, when the Institute of Medicine published its landmark report, To Err is Human. They estimate 44,000 to 98,000 unnecessary inpatient deaths per year in the U.S. due to medical errors, with up to 1 million excess injuries annually occurred. More recent data, a 2013 study of the Journal of Patient Safety, put the number much higher, 210,000 to 444,000 deaths annually. That would make medical errors potentially the third leading cause of death in the U.S. One major contributor, adverse drug events. According to AHRQ, these events sent 700,000 patients to the ER and led to 100,000 hospitalizations every year. Nearly 5% of hospitalized patients experience them, and the risk spikes during transitions of care, like discharge or transfer. And globally, the World Innovation Summit for Health in 2015 emphasized that preventable errors should never be acceptable as inevitable. They are still a major concern, driven not just by clinical practice, but also by system design, workflow, and technology integration. For biomedical technicians and clinical engineers, your role is front and center in reducing these risks. You ensure devices are reliable and safe, support medication delivery systems like infusion pumps and barcoding, and reduce risk during care transitions by keeping systems interoperable and user friendly. The key takeaway is medical errors aren't just a clinical issue, they're a socio-technical issue. Your work in healthcare technology management directly affects whether technology becomes a safeguard against harm or another source of risk. Let's dive into adverse events and what they mean for healthcare technology management. According to the FDA, an adverse event is any undesirable experience linked to the use of medical products in a patient, and the consequences can be serious. They can be life threatening conditions, hospitalizations, new or prolonged, emergency or urgent care visits, disability, or permanent damage. So, where do these events actually happen? The answer is everywhere: hospitals, nursing homes, pharmacies, long term care facilities, even in the patient's own home. Most occur in hospitals or inpatient settings, but here's the challenge. Outpatient events are often underreported because data from ambulatory care is fragmented. The HTM connection now. For biomedical equipment technicians and clinical engineers, adverse events highlight just how critical your work really is. First, ensuring device reliability and safety, testing, calibrating, and maintaining equipment to prevent harm. Second, recognizing the role of user device interaction. Poor design, confusing interfaces, or workflow mismatches can all contribute to errors. And third, supporting event reporting and root cause analysis. When a device is involved in an adverse event, you help uncover whether it was user error, system design, or equipment failure. Adverse events aren't just about clinical decisions, they reveal where technology, human factors, and system design intersect. And HTM professionals play a direct role in reducing these risks by keeping technology safe, effective, and reliable across all care settings. Let's talk about issues facing developing nations and healthcare technology management. Developing countries often face a heavier burden when it comes to medical errors. They deal with the same challenges as wealthier nations, but a set of unique factors adds more risk. First, infrastructure and equipment. Many facilities lack reliable power, proper climate control, or enough functioning devices. And donated equipment? Too often it arrives without manuals, spare parts, or trained support. Second, the drug supply. Medication shortages or even counterfeit drugs complicate care, adding risk even when the technology itself is working properly. Third, limited training and technical skills. Some healthcare workers lack adequate training, which means even perfectly functioning medical devices can be misused or underutilized. And finally, underfinanced operating costs. With low budgets, preventive maintenance is skipped, spare parts aren't purchased, and devices are pushed to failure, raising error rates even further. Here's where HTM comes in. For biomedical technicians and clinical engineers, these realities highlight the need to train staff in safe equipment use and basic troubleshooting, design or adapt devices that are rugged, low power, and easy to maintain in low resource settings, advocate for budgets that support preventive maintenance and sustainable infrastructure. and support international HTM initiatives that strengthen training, supply chains, and safety standards. In developing nations, medical errors often stem not just from clinical practice, but from fragile technical infrastructures. Strengthening HTM capacity is one of the most direct and effective ways to reduce harm and improve patient safety. For years, when errors happened in healthcare, the focus was always on the individual. A nurse missed a step, a technician forgot a task, and the culture was name and blame. Punishment was common, but the system itself left unchanged. Today, that perspective has shifted. Now the focus is on the system. Inadequate workflows, gaps in training, poorly designed or maintained technology, ineffective information systems. The modern view recognizes this truth. Good people can make bad mistakes if they work in flawed systems. The solution isn't to punish, it's to fix the system. For biomedical equipment techs and clinical engineers, this means looking past user error to ask bigger questions. Was the device design confusing? Was training inadequate? Was the workflow flawed? Technology failures are rarely just technical, they're often systematic. A culture of safety isn't about blame, it's about building systems, workflows, and technologies that set people up for success and protect patients from harm. Let's talk about slips, a common type of individual error. Slips are unconscious mistakes. They don't happen because someone lacks knowledge. They happen when attention breaks down, especially during repetitive or routine tasks. For example, a nurse might bypass an infusion pump alarm without realizing it, or a BMET might forget to recheck one calibration step in a preventive maintenance routine. Slips often occur when attention is diverted. Maybe you're called away mid task and return later, missing a step. And factors like fatigue, stress, frustration, or even pressure during an emergency increases the risk. For HTM professionals, slips might look like forgetting to reconnect the sensor cable, accidentally leaving a device in test mode, misclicking a menu option under time pressure. The takeaway is slips aren't about incompetence, they're about being human under stress and distraction. The solution? Safer device design, built in fail-safes, and simple tools like checklists to catch errors before they cause harm. How do we reduce slips, the unconscious mistakes that happen when attention falters? The answer is simple. Limit the opportunities for distraction and fatigue. Clinically, think about physician residency. For years, residents worked exhausting shifts and error rates climbed. Duty hours limits were eventually introduced to cut down on fatigue related mistakes. For HCM professionals, the same risks apply. A BMET rushing through multiple service calls might forget a final safety check. An engineer working overtime could miss a critical configuration step. The solutions are to manage workloads to prevent fatigue, use checklists to catch skipped steps, design devices with fail-safes and prompts, and most importantly, build a culture that values safety over speed. Whether in clinical care or in technology management, slips are best reduced when systems are designed to protect against fatigue and distraction, and when teams reinforce safe, deliberate work. Not all individual errors are unconscious slips. Some are mistakes, errors of conscious thought, and they usually fall into two categories: rule-based errors and knowledge-based errors. Rule-based errors, these happen when the wrong rule gets applied. In clinical care, a nurse follows the wrong medication protocol. In HTM, a BMAT uses the wrong troubleshooting sequence or applies a service manual procedure to the wrong model. And when dealing with knowledge-based errors, these occur when someone faces a completely new situation without the right expertise. In clinical care, a doctor misdiagnoses a rare condition. In HTM, a technician misconfigures a new network device because the software is unfamiliar. The insight for HTM is this: mistakes highlight gaps in training, expertise, or system design. Rule-based errors point to a need for clearer protocols and labeling. Knowledge-based errors stress the importance of continuous training, mentorship, and reliable documentation. Slips are about lapses in attention. Mistakes are about decision-making under rules or knowledge. As HTM professionals, you can reduce mistakes by making sure systems are clear, training is ongoing, and devices are designed to guide safe decisions. Let's talk about how to solve two types of mistakes: the rule-based and knowledge-based errors. So with rule-based errors, this happens when the wrong rule gets applied. In HTM, that could mean following a checklist for the wrong ventilator model. The fix: use clear labeling and documentation, keep digital manuals up to date in your CMMS, and apply standardized checklists so steps aren't skipped or misapplied. With knowledge-based errors, these happen when someone faces a situation they've never seen before. For HTM, that might be misconfiguring a new smart infusion pump because the software is unfamiliar. The fix: expand training, encourage consultation and collaboration, and build shared documentation libraries so lessons learned don't disappear. Whether in clinical care or HTM, mistakes are reduced by supporting the decision maker with better rules, better knowledge access, and stronger teamwork. Unlike individual errors, organizational system errors happen because of inadequacies in the larger healthcare system. And here's the tricky part: these errors are shared across multiple people and departments, which makes them harder to see and even harder to fix. Multiple touch points, for example. Take infusion pumps. Pharmacy programs a drug library, nurses set up the device, and HCM staff maintain it. If there's a gap at any step, the error cascades through the system. Next, different actors, same workflow point. Maybe every shift of nurses bypasses the same alarm condition, or multiple techs miss the same calibration step. These patterns point to a system problem, not just one person. Hard to analyze. Because these errors spread across roles, root cause analysis often reveals bigger issues: poor policies, broken communication, or weak interoperability between technologies. For HCM professionals, system errors may look like preventive maintenance skipped because staffing is underfunded, devices that won't integrate into the EHR, alarm fatigue caused by poor design, not negligence. System errors aren't about a single mistake, they're about organizational gaps. For HTM, the fix requires collaboration across IT, nursing, and leadership to change policies, improve workflows, and build safer, more reliable environments. Medication errors are one of the most common types of organizational system errors, and they often happen during transitions of care when communication is most fragile. The numbers tell the story. About one-third of patients have unintended medication changes when they're transferred between hospital units. Around 14% experience changes at discharge, and more than half of patients have at least one discrepancy when they're admitted. So, where does healthcare technology management fit in? While clinicians prescribe and administer medications, HTM professionals are critical to making sure the technology that supports them works flawlessly. Infusion pumps and drug libraries: if they're not updated or maintained, they can introduce dangerous dosing errors. Barcode medication systems: if scanners go down or don't integrate with the EHR, clinicians may be forced to risky workarounds. Pharmacy automation systems: A calibration mistake or software glitch can lead to wrong drug, wrong dose dispensing. Medication errors aren't just clinical mistakes, they're also shaped by the design, reliability, and integration of medical technology. For BMEDs and clinical engineers, keeping these systems safe and interoperable is one of the strongest defense against harm. One of the most effective ways to reduce medication errors is through medication reconciliation, the process of making sure medications stay accurate during every transition of care. And here's how it works. At admission, compare a patient's current medications with those being prescribed. At transfer, recheck the list to ensure accuracy across units. At discharge, confirm the final list so patients leave with the right medications. And during ongoing care, review or audit can catch discrepancies early. Now, the HTM connection. While clinicians do the reconciliation itself, HTM professionals make it possible by keeping the supporting technology safe and reliable. EHR integration, ensuring medication modules work seamlessly with pharmacy and bedside systems. Barcoding and scanners, keeping verification systems running so clinicians can confirm the five rights: right patient, drug, dose, route, and time. Smart pumps, supporting drug library updates and maintaining device reliability to prevent dosage errors. Audit support, making sure device data is logged and accessible for review. Medication reconciliation is a process, but its success often depends on the technology the HCM professionals have to maintain. Reliable systems give clinicians the tools they need to keep patients safe, especially at those vulnerable points of transition. Medication reconciliation is all about keeping medication lists accurate during care transitions, and several methods are being used to reduce errors. Audit processes compare across every point: physician orders, pharmacy fulfillment, nursing documentation, and the EHR. This ensures consistency, but it only works with strong IT systems and good communication. Linked to CPOE and MAR, tying reconciliation to physician order entry and the medication administration record, the MAR, creates a legal record of what's given. Electronic MARs or EMARs make real-time checks possible. Full EHR integration. Embedding reconciliation directly into the EHR, pharmacy, and MAR adds layers of alerts across systems to the prescribing administration chain. Patient engagement. Some suggest patients and family take on reconciliation themselves. It shifts responsibility but emphasizes patient centered care and may reduce communication gaps. The evidence so far: research shows reconciliation reduces errors, but it hasn't consistently proven to improve survival or satisfaction. More data is needed. For the HCM professional, the role is clear. Keep EHR linked devices like smart pumps, barcoding scanners, and EMR terminals reliable and integrated. Maintain alert and alarm systems so they work as intended, without overwhelming clinicians with false alarms. Collaborate with IT and pharmacy to ensure devices and systems truly are interoperable. Medication reconciliation is a team effort, and technology is at its core. For HTM professionals, ensuring reliable, integrated systems is what makes safe reconciliation possible. Patient safety isn't optional, it's essential, and reducing errors takes effort from everyone: individuals, organizations, and entire systems. So, who's driving these initiatives? Clinicians, physicians, nurses, and allied staff lead daily safety practices, advocating for protocols, checklists, and consistency at the bedside. Hospitals, institutions adopt safety programs, track adverse events, and train staff. Many partner with HCM teams to ensure devices, alarms, and integrations supports safe care. Regulatory bodies. The Joint Commission mandates safety standards for accreditation. Initiatives like the Wrong Site Surgery Project and WHO's Safe Surgery Guidelines push system safeguards, while the 2005 Patient Safety Act promotes confidential reporting. Patients. Families are stepping in too, reviewing meds, asking questions, and demanding safer practices. Safety is now part of the consumer healthcare movement. Other leaders. The National Patient Safety Foundation, founded in 1997, envisions care free from harm. Publications like PSQH spread strategies, case studies, and innovations. The HCM connection. For BMETs and clinical engineers, your role is clear. Keep equipment safe and reliable. Collaborate with clinicians and IT to strengthen safe culture. Support reporting systems and root cause analysis when devices are involved in adverse events. Patient safety is everyone's responsibility. For HCM professionals, your technical expertise is a vital piece of this larger, multi stakeholder effort to reduce errors and make care safer. Up this section on socio-technical aspects, clinicians, and technology. We explored how people, processes, and technology come together, sometimes smoothly, sometimes with serious risks to shape patient safety. We defined medical errors and patient safety and looked at their scope and impact. We examined challenges not only in the US, but also in developing nations where limited infrastructure adds unique risks. We distinguished slips from mistakes, attention lapses versus decision making errors. We talked about system errors, where workflows and technology integration break down in complex, hard to trace ways. We reviewed medication errors and how reconciliation strategies can reduce harm. We looked at the driving forces behind patient safety initiatives, from clinicians and hospitals to regulators and even patients themselves. For HTM professionals, here is the connection. Every device you maintain, calibrate, or integrate plays a role in patient safety. Understanding slips, mistakes, and system errors equips you to design, support, and troubleshoot technology in the messy real world of healthcare. Patient safety isn't just a clinical responsibility, it's a socio-technical responsibility. And as BMETs and clinical engineers, you are essential partners in making healthcare safer.